Hello, good afternoon. My name is Jennifer Lee. I'm your host of Medicare 360. Today we are going to go over the Identity Shield, hospice fraud, stolen identities, and the 267 million SoCal crackdown. So I really definitely want you to lean into this one because what I'm about to tell you is happening right here in Southern California, not in another state, not online somewhere far away, right here in SoCal, Los Angeles County. So last week, April 9th, the California Department of Justice announced something shocking. They dismantled a 267 million fraud ring targeting Medicare and Medi-Cal. Medi-Cal in other states is called Medicaid. So let me translate this into plain English. Someone may have to use your name, your Medicare number to bill the government for services you never received. And the most disturbing part, they weren't billing for checkups or band-aids. They were billing for hospice care. So now let's slow down for a bit because this is where it gets serious. Hospice is just not another medical service. It's what Medicare uses when someone is considered mentally ill. So if a fraudulent provider signs you up for hospice without your knowledge, on paper, you are now at the end of life. So this means you could be denied life-saving treatments. You could lose access to certain medications. Your entire care plan could be quietly rewritten. So this is just not fraud. This is what I called a clinical identity theft. And here's your first action step today. When you get your Medicare Summary Notice, your MSN, don't just glance at it, audit it. Look specifically for hospice service, home health agencies, medical equipment you didn't request. If you see something unfamiliar, do not wait. That's your red flag. Okay. So even with this, let's just say that you did not give your Medicare number out. So that's definitely identity fraud. But let's just say you were approached by someone or what I've been seeing a lot is being approached by professionals like an attorney that does like file settlement places or just like senior like resource people trying to provide you more benefits and resources. So what I've seen is they may approach you, they may say, there's a senior program, we could give you $500 a month because of your income, or what else have I seen? We'll give you some medical supplies, just whatever it is to entice people to get on the program, right? But be it you not knowing that you signed up for hospice, right? Which really means you are not supposed to get better. You're not supposed to be treated at the hospital. It's your end of life and you just want to be comfortable because you are going to pass away soon, right? So that's that. So be careful, be leery. We had a case last week in where one of our clients was actually going to be penalized forever because she did not have a drug plan. So what they did with her was, her and her husband, I believe, what they did with her was they took her off her Medicare plan that she was on, canceled her drug plan. Thus, when she wanted to go back on the plan that she was on, they basically, now the insurance companies, Medicare is all like, oh, you didn't have a drug plan, we will penalize you, right? Of no fault of her own, because she did trust these individuals. I mean, I believe it was an attorney. The business card said it was a attorney, but who knows, right? We just don't know. So, as you guys know, AI is getting more prominent. So, unfortunately, now while criminals are getting smarter, Medicare is fighting back with something that's going to change everything, which really is that artificial intelligence. So, this year, Medicare launched a new pilot called the Wasteful Inappropriate Service Reduction Model. Think of it like this: before certain products get approved, an AI system now reviews the claim, not after, before. For 14 categories of care, this AI is acting like a digital gatekeeper. Now, that sounds great for stopping fraud like hospice scandal, but here's the reality for you. The computer doesn't know you, right? It doesn't feel urgency. It doesn't see pain. It sees patterns. So if your procedure gets flagged as not necessary, you may need to be pushed back. You need to push back, right? So that's the thing, right? There are like pilot programs right now in 6 states where they're actually looking at, say, 20 of the highest fraudulent services providers do fraudulent claims on, and you have to get an approval. So I just feel like people are being punished because of all this fraud, right? So definitely, we definitely need to put things in place for this, which sounds like, it is finally happening. So April, open enrollment is definitely over. Of course, there might be special enrollments for you if you're just not happy or need a change. So if Medicare does deny a claim, you do have rights. You can appeal. You can request a review. You could involve your doctor, right? So oddly, some of my clients are just like, how do I know if something is covered if I'm on original Medicare? There is an app you could download, but of course, your doctor and your doctor's office should know if these procedures should be approved. I had a client last week that they basically had a setback because the doctor's office was just refer to your, insurance plan or Medicare. And it's just like, okay, you're my doctor's office. Shouldn't you know this stuff too? Okay. So, the Center of Medicare and Medicaid Services, CMS, is also rolling out something called the Kill the Clipboard Initiative. And if you're ever, filled out the same paperwork 5 times in a week, you're going to love this. So by mid 2026, you'll be able to share your medical records with a QR code, okay? Eliminate redundant forms, reduce exposure to your identity theft. Less paper means fewer opportunities for your information to walk away. The only thing I don't like about this is like, what if you, the senior, doesn't know how to use a QR code? You don't have a phone, a camera on your phone. But more details when that does come out. So now let's talk about something everyone feels immediately, which is your wallet. This is the first full year of negotiated drug pricing under Medicare. So if you are taking medications like Eliquis, Jardiance, Januvia, you should already be seeing the major service savings. I'm talking about 50, 60, and even 7% lower in some cases. So here's your second audit. Pull out your latest pharmacy receipt, and the numbers look like last year. Something may be wrong. Your plan may not be updated, and that means you're overpaying. So every little dollar counts. Definitely reach out to us, and we could help you with that as well. And then don't forget, I think I mentioned this last week, is Medicare did introduce that hard cap on prescription drug costs, that the number is $2,100. So once you hit it, you're done. No more copays, no more surprises, no more choosing between groceries and medication. So for people managing chronic conditions, this is one of the biggest changes Medicare has made in decades. So just keep in mind, because of this, the formularies may have changed, right? If the formularies may have changed, your drugs might be not covered or might be covered in a higher tier. So definitely keep that in mind when you're paying for your drugs. And then if you have any questions, definitely feel closer. Feel open to call us. So let's go back to identity protection. Let's bring it full circle. So we did start today with a 260 million fraud ring. So how do you make sure you're not part of the next one? You go digital, you go secure. Medicare now offers something called the blue button. So it allows you to download your claims history, access your records instantly, monitor activity in real time. So keep in mind though, sometimes like when you get your statements, it still says it's processing. So it is not the final bill. So don't pay anything unless it's not final. And if something doesn't seem right, like let's just say you have the original Medicare with a deductible, then the most you would pay is your deductible. So just make sure you are looking at that. So I would suggest setting up a secure login using login.gov or id.me. It does add multi-factor, authentication, sorry, which means someone tries to access your account, you'll know immediately. So with this, it's a little bit more work, right? When you create a user ID and password, often it will ask for your ID, like your driver's license. You take a picture front and back of it. And then after that, you take like a picture on your phone of your face. And it's some type of, like face recognition. The nice thing is when it just was first implemented, it was super like frustrating because for some reason it wouldn't take. But now it's gotten way better on that. So just keep that in mind. As time goes on, everything will probably get more digital. But with digital, not everything is like they don't know your case, right? Because it's just weeding through all like electronics and all, if that makes sense. So I would just say, with this fraud, it's very wasteful. Us, tax-paying citizens have to pay for this fraud, and it's just so absurd. In SoCal, in LA County, they've done like those interviews, those videos where basically these are just shell companies, shell locations. There's nothing there. There's like we're not helping seniors. It's so definitely wasteful. And I could share a personal story because the reason why I got into Medicare is because of my in-laws. I've been life and health licensed for a very long time, and I didn't know Medicare. And my in-laws, for some reason, they were always changed every single year. Like their plans change, and I'm just like, what's going on with that, right? So I did some digging, and just to back up on that story. In my personal case, my in-laws lived with me. One morning, my father-in-law just could not get out of bed. And, while I do help with insurance claims, medical claims, like on the insurance coverage side, I really don't know anything about like the medicals, right? Like I'm not a doctor, I'm not a nurse. I wasn't trained in that. So he couldn't walk. Come to find out, it was a stroke, right? Like when he couldn't walk and get up. Anyways, I was sifting through their like files, like their documentation, and I came across this folder where basically it said stop. Do not resuscitate client. Call this number instead. And I was like, what is this? And obviously looked it up and did some research. Basically, he was put on hospice. Okay. My father-in-law had Alzheimer's. Okay, but like hospice, like, is he gonna pass away in 6 months? Like, no, I don't think so, right? Looked at their bills, started looking at their bills, and like, what? This doctor was charging them $5,000 a month. Okay, that's what, $6,000, and this was a while back, so of course it's probably more now. And so, looked this doctor up, had really bad reviews. Never saw this doctor, never came to my house. No nurses ever came to my house. No one was really helping my father-in-law. And it's so disheartening, right? Because at that time too, it's like, okay, call this number. So basically he was already in hospice, like fine. And yeah, so I asked a colleague in that industry to help me review his case. Basically, they were transferring him to a different hospice company every 6 months. Every 6 months. Okay, that's crazy. No wonder, like, California is so much in debt, right? Like this fraud. And fortunately, like, I wanted to report it so bad, but my in-laws are just so like, come from that Asian thinking where, they're scared. No, we don't want to rock the boat and everything. Um, yeah, it's pretty hard for me. So then, yes, because of the stroke, then yeah, because of the stroke, then yeah, then he would qualify for hospice, right? So unfortunately, he got pneumonia. The hospice nurse was here, and like, I think he wasn't breathing, so my husband was like, we got to take him to the hospital, right? This is not how he's going to pass. We want to make sure what's wrong with him. So good thing the hospice nurse was here, because let's just say we took him to the hospital because he was in hospice, they would be like, that's not covered, right? Because hospital means you want the person to get better, not like help them feel better when they pass away and just make them comfortable, right? So luckily the hospice nurse was here. She just took him off hospice. So now when I went to the hospital, it's covered. So yeah, like, if you don't know that you're on hospice, you go to the hospital, then who knows the bill, right? And like, I've heard situations like this where someone's on hospice and they call us. I had that one incident where they're calling us trying to get, like, say the husband on a Medicare plan, and we just weren't able to do it. And it's like, hey, once the husband died, the wife got a bill for like 8,000 or something like that. So really, really understand your plans. If not, have someone like a licensed, certified life and health agent that specializes in Medicare to help you with this, because you do not want to foot the bill if you didn't need to, right? And then if it was some type of fraud. So yeah, I personally went through it, and it is it. I just can't even put it into words. How shocking and violated we felt on that. Just on a side note, if you do have parents, and sometimes you're just like, hey, they could take care of things on their own, but as they do get older, like, helping them with their care, because things change, right? Like, doctors, facilities, medical places, like you may know or do better research on where they could get better care, like even managing their medication is a big thing, right? So watch out for that. Watch out for your parents or your family members because, their care, having the right coverage, having the best care you could afford is definitely something you need to make sure, right? So that is my story for my father-in-law. It's very unfortunate. So it is near and dear, this hospice fraud, and I'm glad that these rings are basically caught. Hopefully we don't see it, but of course, these criminals, they do get more savvy and so forth, which is unfortunate. Okay. So, really, number one, review your Medicare summary notices. Look for any hospice or home health charges. I mean, I saw it. I mean, I don't like to pry into, you know, my parents or in-laws' business, but I mean, at that time, it's just like I should have, right? Like, I mean, reading it, they probably didn't understand it. They don't know what this all is, right? So me reading it is just like, wow, this is definitely crazy. So secure your accounts. Please do not give your information over the phone or just to anyone. There's a lot of Medicare fraud going on, even people that represent themselves as being professionals. So be very careful and leery about that. Check your prescriptions. Number three, make sure you're getting 2026 pricing, that your insurance company and your pharmacy actually has the right information on that, and just understand how your plans work, right? So your Medicare number is more than an ID. Before, they used to have your social on there. They did change that to a Medicare number. So please keep that handy. If you are in a Medicare Advantage plan, you really don't have to carry your Medicare number. You could keep it in a safe. If you are on original Medicare and a supplemental, yes, carry your Medicare number with your supplemental plan, or if you have Medicaid, Medi-Cal, because that's how they will identify and bill, right? Medicare. So it is your access to your care, your finances, your future. It's something that you do want to protect, like you would your home, right? There's so many cases, so many fraud going on. I really hope it does stop and lessen because of all this and all. I mean, it's just so much waste and all. So my name is Jennifer Lee. I'm your Medicare 360 radio show host. And if you have any questions, concerns, just want to talk and chat, we are more than happy to help and assist you with everything. We are a resource to the community, number one. So anything you want to talk about, questions, concerns about your health care, the level of care you receive, your coverages, how it all works, because it does really get confusing, please definitely reach out to us. You have a wonderful day. I look forward to seeing you next week. Thank you. Bye-bye.